As we all know, Nigeria's healthcare sector is facing an exodus of doctors, and at the core of this crisis are poor working conditions, inadequate hospital facilities, lack of government interventions, among others. The Minister of Health and Social Welfare, Mohammed Pate, recently disclosed that only 55,000 licensed doctors remain in Nigeria, serving a population of over 200 million people. This means roughly one doctor for every 3,600 people, far from the World Health Organization's recommended ratio of one doctor to 600 people. Over the last 5 years, 16,000 doctors have left the country, while another 17,000 have been transferred within Nigeria's broken system. A glaring example of this healthcare collapse is the Federal Teaching Hospital in Lokoja, where doctors have taken to the streets in protest. Their grievances are deplorable working conditions, lack of essential medical equipment, unpaid wages, and exploitative contracts. The hospital, which was once staffed with 315 doctors, now struggle with just 43. Many who are mostly on contract are then forced to renew their contract every 2 months without job security, pensions, or hazard allowances and unusual work overtime. The situation has turned tragic. Dr. Olushola Baoku, speaking during another peaceful protest at the premises of the hospital, said patients are dying from preventable causes due to power outages, lack of basic medical tools, and an overwhelmed workforce. In one heartbreaking case, a hospital worker died because the facility lacked electricity to provide emergency care that the ICU can barely keep a patient stable for 3 hours. In some instances, frustrated relatives of sick patients have resorted to attacking doctors, blaming them for the system's failure, inasmuch as the health budget for Nigeria was 5.46% of the total proposed expenditure. Despite multiple petitions and protests, the government's response has been sluggish. Doctors who dare to speak up, like Dr. Jimoh Umar, faces suspension or even termination. Even after the Minister of Health approved his reinstatement, hospital management have refused to comply, exposing deeper issues of institutional corruption and neglect. At this rate, Nigeria's doctor-to-patient ratio will only worsen as more medical professionals seek opportunities in countries where they are valued and supported. If urgent reforms aren't made, the country risks a full-scale collapse of its healthcare system. Don't forget to follow us on all our social media platforms at Fact News Africa and Fact News Hausa.